Cagro Biotech Company Limited fundraising proposal. Central issues. Cagro Biotech is founded in 2008, specializing in the research and development of new drugs derived from Entrodia cinnamomea and Archeum plants, aka burdock. Currently, there are 6 botanical drugs under development by Dr. Cheng Yishan, who holds the record for the most successful applications for botanical drugs in Taiwan, serving as our principal investigator. These 6 botanical pharmaceuticals are expected to collectively obtain licensing fees totaling $1 billion upon the completion of Phase 2A and $1.5 billion upon completion of Phase 2B. Since all 6 botanical drugs have entered the IND stage, we plan to list on the NASDAQ in the United States through a de-SPAC approach. The funding required for the listing is $5.4 million USD. Core team members. General Manager, Chairman, Mr. Li Xiqiang, the founder of Cagro Biotech Company Limited, has been engaged in the biotechnology industry for 23 years. He is familiar with the dynamics of the biotechnology industry, possesses a range of biotech resources in both Taiwan and China. Chief Technology Officer, Dr. Chen Jeffu, former Director of the Taiwan National Research Institute of Chinese Medicine, Professor at the National Defense Medical Center and the Taiwan National Yangming University. Chief Operating Officer, Mr. Da Yuander, PhD student, College of Management, Choyu University, Taiwan. Senior employee of Cagro Biotech Company Limited. Since founded. C-Money Financial website columnist. Principal investigator of new drug development project. Dr. Cheng Yishan, General Manager of Megas Biotechnology Corporation. 2016-2018 Vice Dean of Institute of Pharmaceutics, Head of Natural Extraction and Separation Division. He is the expert who has successfully applied for the most new drugs in Taiwan. Burdock R&D Chief Consultant, Dr. Chen Fuan, PhD in Pharmacy from the School of Pharmacy, Taipei Medical University. The Director of Research and Development and International Cross-Strait Affairs Office and Professor in the Department of Pharmacy at Taizheng University of Science and Technology. Entrodia cinnamomea R&D Chief Consultant, Dr. Chang Tan Chu, PhD in Plant Pathology from the University of Hawaii. Researcher at the Forestry Research Institute of the Council of Agriculture, Taiwan. He is the first scholar globally to publish a scientific report on Entrodia cinnamomea. Competitive advantage. Integrate advantages. Cagro Biotech is one of the rare biotechnology and new drug R&D company in Taiwan and even the world that has completed vertical integration from raw materials, functional foods, health foods to new botanical drugs. It has completed the 3 aspects of a self-produced raw materials, self-owned technology, and self-produced production. Product advantages. The 6 botanical drugs currently under development in the project, which is listed below, have significant market size and growth rates globally. Archeum related. 1. New Archeum LAPA drugs for post-fracture healing. 2. New botanical drug against peptic ulcers. 3. New botanical drug using Archeum LAPA against benign prostatic hyperplasia. Entrodia cinnamomea related. 1. New botanical drug using Entrodia cinnamomea for diabetic wound healing. 2. New botanical drug using Entrodia cinnamomea against diabetes. 3. New botanical drug using Entrodia against atopic dermatitis. R&D advantages. The project is currently developing 6 new botanical drugs, with Dr. Cheng Yishan, who holds the record for the most successful applications for botanical drugs in Taiwan, serving as the project's principal investigator. Leveraging the research foundation of Cagro Biotech Company Limited, the development costs for the new drugs are extremely low, with a success rate assessed at 95%. The research team includes Professor Qifu Chen, former director of the Taiwan National Research Institute of Chinese Medicine, Dr. Chen Fuan, a burdock authority, and Dr. Changtan Su, an expert in Entrodia, all above demonstrating strong research capabilities. Market layout. Phase 1. Establish a marketing team for health products in Taiwan. Establish subsidiaries in Singapore, Japan, and China. Complete listing on NASDAQ through the SPAC. Acquire a petri dish cultured Entrodia factory. Phase 2. Establish a petri dish cultured Entrodia demo factory in Singapore. Establish a burdock food processing factory in Japan. Complete the IND stage of 6 plant-based new botanical drugs. Establish marketing teams for functional foods in China, ASEAN, and Japan. Phase 3. Establish an international sales team for new botanical drugs. Complete Phase 1, Phase 2A, and Phase 2B R&D stage. Apply to obtain medical device permits for external use. Gradually obtain technology licensing fees. Launch external use new botanical drugs. Business models. Raw materials. Items for sale. Petri dish cultured Entrodia and extract. Yanagawa variety burdock extract. Business models B2B OEM. Health supplements. Items for sale. Petri dish cultured Entrodia derived health supplements. Burdock derived health supplements. Business models B2C, OEM, and private brand. Technology licensing. After completing the IND, we can proceed to negotiate licensing arrangements. Business model B2B and technology licensing. Sales of topical medications. Items for sale. New Arxium Lapa drugs for post-fracture healing. New botanical drug for diabetic wound healing. New botanical drug against atopic dermatitis. Business models B2B technology licensing and B2C. Partner. Our technology partners, Taiwan's Industrial Technology Research Institute, ITRI, Development Center for Biotechnology of Taiwan, Megas Biotechnology Corporation. Taijin University, Oasis Biotech Co., Limited, Hansheng Pharmaceutical Technology Company, Limited, China Academy of Chinese Medical Sciences, and Fujian Academy of Chinese Medical Sciences. Sales channel partners include China National Pharmaceutical Group Corporation, Guizhou Matai Beijing Liquor Company, Limited, Beijing Tongren Group Company, Limited, JD.com, Inc., and Shanghai Oriental TV. Products and technology. New drug against peptic ulcers. Market overview. According to research, there were approximately 50.4 million patients with peptic ulcers globally in 2013, with an incidence rate of approximately 810.7 per 100,000 people. Additionally, a study from 2016 reported approximately 87.41 million cases of acute peptic ulcers in 2015. New drug against benign prostatic hyperplasia. Market overview. According to research, the continuously growing population of elderly males globally is a key driver fueling the development of the benign prostatic hyperplasia (BPH) drug market. According to the UN's World Population Aging 2019 report, there were 703 million people aged 65 or older in 2019, and the number is estimated to double by 2050 to around 1.5 billion. New drugs for post-fracture healing. Market overview. As the global senior population continues to grow, incidence rates of osteoporosis, knee joint wear, and chronic back pain are climbing as well. Additional causes such as increased traffic accidents around the world and repairs and reconstruction upon sports injuries, among others, are pushing incessant increases in the demand for orthopedics-related medical devices or treatments and their growth on the global market. New drug against atopic dermatitis. Market overview. According to research, atopic dermatitis primarily affects children, with approximately 5 to 20% of children globally being affected. It is most common in children under 5 years old, with a male-to-female prevalence ratio of about 1 minute and 1.3 seconds. While it can also occur in adults, the prevalence rate is harder to estimate. Nevertheless, both in Taiwan and other countries, there is a trend of increasing incidence rates among adults over the years. New drug against diabetes. Market overview. Data from WHO showed that the number of people with diabetes grew from 108 million in 1980 to 422 million in 2014, especially in low and middle-income countries. Diabetes is the main cause of loss of sight, renal failure, heart attacks, strokes, and lower limb amputation. The number of premature deaths caused by diabetes increased by 5% during 2000 to 2016. In 2019, diabetes became the 9th leading cause of death globally, with projections indicating it will rise to the 7th leading cause by 2030. New drug for diabetic wound healing. Market overview. According to the data of Global Data, diabetic foot ulcers, DFUs, are a disease characterized by infection, ulceration, and/or deep tissue injury. The most common root causes of DMUs include diabetic neurological and vascular complications, high plantar pressures, trauma, and deformity. It is projected that the number of DFU patients rises as the prevalence of diabetes in all markets. Financial forecasts can be found in the attachment. NASDAQ listing process. 2023 Cigna contract. Cigna contract with a U.S. advisory securities firm. Transform financial statements into the format required for a U.S.-listed company. Dr. Zhuang Shuirong, an authoritative appraiser in Taiwan, valued Cagro Biotech at $400 million. 2024 Legal coordination. Raised funds for the U.S. listing process. Conducted accounting, auditing, and legal coordination. Completed the transformation of U.S. standard documents. 2025 Dispatch. Completing the listing on the NASDAQ in the United States. Cagro Biotech, established for 15 years without any big consortium shareholders, has persevered in R&D under such challenging conditions, earning 6 tickets to plant-based new drugs. Going public in the US will mark the final leg of our journey towards success.